So, hi students, again, like every year, we are summarizing all the updates in A to Z mode. Like students, they say, sir, it is very easy for me to remember in alphabets. So, can you summarize important updates for me in alphabet mode? So, at least I can differentiate what is what. Like, after reading all the subjects, most of the times, everything seems to be same for me. That is what the response of my students. So, every year I am doing this video summarizing all the updates in A to Z mode. Important. Usually they will ask what is this initiative, what is the purpose of this initiative, and they won't make it more difficult. If the questions are totally difficult, it is difficult for everyone. But what you should know at your level is like what is Anemia Mukt Bharat if they ask, or what is Kaikal, or what is open while policy. Important updates you should know in alphabet mode so that it will become easy for you to recall in the exams. So come to the first alphabet, Antara. You'll be knowing this. It is an injectable contraceptive, medroxyprogesterone acetate injection. So it is progesterone based, intramuscular route, given once in 3 months. Antara means gap, given once in 3 months. It is suitable for lactating women. Yes, it is suitable for lactation. It is a part of Mission Parivar Vikas. Yes, it is one of the newer contraceptives under Mission Parivar Vikas. Come to next, Anmol, ANM online. So what is the use of this application? When you have an ANM at sub-center level, she'll be having data related to contraceptives, pregnancy care, and child care. We have to maintain that data. It is very difficult for her to write in hard copy or keep a book for that. Better to go to online, enter all the data. You can keep the data with you related to three things: contraceptives, child care, and mother and child health care. So maternal and child health care related data entry. Good. Come to the next important. Most of the times in India, out of pocket expenditure like we are spending for drugs and other costlier implants. So what is the use of Amrit retail stores? Then you can see in the hospital Amrit stores. What is the full form? Affordable medicines and reliable implants for treatment. So what they are giving in this, they are giving one cancer chemotherapy drugs at a reasonable rate, two cardiovascular drugs at the same time cardiac implants. Repeat with me, CCC, cancer chemotherapy, cardiovascular drugs, and cardiac implants. That is what is the use of Amrit stores, providing drugs at the same time affordable implants related to treatment. Implants means cardiac implant. If they ask there is a patient needs the cardiac implants at an affordable rate, what is the store you can get? They can give any option, and the answer is Amrit. Repeat with me. Good. 1, 2, 3. Antara. Yes. Tell me. Anmol and Amrit. Come to the next alphabet. A. Again important. One more thing in this alphabet. A, that is Ayushman Bharat Health Protection Scheme, has two components. This is under Ministry of Health and Family Welfare, has two components. Health and Wellness Centers. As you can see here, all sub-centers and primary health centers in India will be converted as health and wellness centers in the future. So what is the use of health and wellness center? To provide comprehensive primary health care. Tell me good. Comprehensive primary health care. By giving allopathy, along with that allopathy, we are introducing other modalities into the management, that is health and wellness centers for comprehensive primary health care. Ayushman Bharat has two components, one and two. The second is Pradhan Mantri Jan Arogya Yojana health insurance scheme. I'll be discussing it later in the alphabet P when I'll be discussing other Pradhan Mantri schemes for you. Good. Come to one more important, Atal Bimit Vyakti Kalyan Yojana. What is the use of this scheme? It is under Ministry of Labor and Employment. under ESI scheme, it is related to unemployment. If there is unemployment due to any reason, closure of factories, at that time this scheme will help in providing relief for the workers. Repeat, under which ministry? Labor and Employment. Under ESI scheme related to what? Unemployment allowance. Unemployment allowance. Good. Harsh clinics. What is Harsh clinics? Harsh का full form बताओ. Tell me. Good. Adolescent reproductive and sexual health. Harsh is a component of adolescent care. राष्ट्रीय किशोर स्वास्थ्य कार्यक्रम has one of the component. That component is to promote adolescent reproductive and sexual health. Harsh clinics will help in promoting what? Adolescent and reproductive sexual health related clinics. If they ask, Harsh is a part of Rashtriya Kishore Swasthya Karyakram. Correct answer. It's important updates you should know because it is a huge topic. But for me, I have to summarize it in a rapid way. So I'm telling the updates, whichever is most important and whichever is updated. Tell me what treatment is used now. TLD is used. Tenofovir, lamivudine, dolutegravir. The second preferred drug is TLE. Before this was the preferred drug, efavirenz combination. Now we don't have efavirenz. We are having dolutegravir in place of that. Repeat, tenofovir, lamivudine and dolutegravir. Lifelong treatment. Start treatment irrespective of CD4 count or clinical staging. That is called as test and treat policy. PPTCT also now in the pregnancy we can use dolutegravir combination. They say yes, it can be used. Before they used to say it has some related congenital abnormalities, but now based on the risk reward ratio, TLD can be used in pregnancy also. You can start TLD in any trimester. As soon as diagnosed, start TLD. For newborn, you are giving nevirapine if the infant is at low risk. Low risk infant means if the mother is already on ART, good, you can use nevirapine. Post-exposure prophylaxis. In India, we are using TLD combination again for 4 weeks. But according to WHO, TED combination is the best. What is TED? Tenofovir, emtricitabine, dolutegravir. Listen to my question. If they ask in India, TLD for 4 weeks. If they ask which is the best regimen for post-exposure prophylaxis, answer should be TED combination for 4 weeks. Like we have TED Talks, TED combination for 4 weeks. What is 90-90-90? Out of total HIV patients, 90 should be diagnosed, 90% should be kept on treatment, and within that 90 should have viral suppression. DTS, D for diagnosed, T for treatment, S for suppression, viral suppression. The same targets was to be achieved by 2020 and that has been revised now. Keep this in mind. 95% has to be diagnosed. Within that, 95 has to be treated and 95% should have viral suppression. I'm telling the word viral suppression, not clinical symptoms. So this has to be achieved by which year? By 2024. Note down this, by 2024. B for blindness, again will be discussed in ophthalmology classes, but still you should know some basics. The program what we have for blindness is National Program for Control of Blindness and Visual Impairment. That is one more addition. The cutoff for blindness if the visual acuity is less than 3 by 60. Both WHO and India are using the same cutoff for defining blindness. The recent prevalence of blindness based on the cutoff is 0.36%, and the most common cause of blindness is cataract. And the target you should know, we have to achieve 0.25% by 2025. Usually they will ask targets of blindness under blindness program. Beti Bachao and Beti Padhao scheme, like girl child safety is very important. We have to promote child sex ratio. If they ask what is the use of this scheme, to promote child sex ratio, good. Related to what? Bachao, child safety, and Padhao, education. Safety and education both. So even Ministry of Women and Child Development will play a part, and also Ministry of Education. Both Ministry of Women and Child Development and Ministry of Education will play a part in this scheme. But if it is implemented mainly by Ministry of Women and Child Development with the help of Ministry of Education also for education, So both safety and education. C for Chaya Centroman tablets. Before it was Saheli, now it is Chaya tablets. Again, one more newer contraceptive. It is oral non-steroidal pill. The chemical is ormeloxifene. Twice a week for first 3 months. Then after 3 months, it is once a week. Once a week tablet is Chaya pills. C for Coven, an application related to COVID vaccines. You can register yourself. You can maintain a data related to COVID vaccine stocks and also COVID vaccine temperature. So RST registration, vaccine stocks and vaccine related cold chain temperature. D for Dakshata, one more initiative to reduce maternal mortality rate. If they ask what is the use of Dakshata to reduce maternal mortality, what they do, they will train doctors and nurses. It is a training program for doctors and nurses related to what? Related to delivery practices, intrapartum care, and immediate postpartum care. If there is hemorrhage, postpartum hemorrhage, which is the most common direct cause of maternal mortality, how to manage. So, what is the use of Dakshata? To train medical officers and ANMs for delivery practices. You can remember like this: D for Dakshata, D for delivery practices. Related to intrapartum care, how to manage any complications during delivery and also immediate postpartum care. E for even, as you know, it is a mobile based application for entering the data. Who will enter the data? Cold chain handlers. At what level? Primary health center. Why? Because it is the last storage point of vaccine. What data is entered related to vaccine stocks and cold chain temperature both? How many vaccines we have, how many we are using, how many left, what is the cold chain temperature at that primary health center, that is also entered. E for ESI schemes, you should know the benefits of ESI. Sickness benefit for 91 days, extended sickness benefit for 2 years. And one more thing what you should know is how much is the premium given. Total 4% of the wage, 3.25% by the boss employer, and the remaining 0.75% by the employee, those who is working. So total 4% of the wage has to go into this as premium. ESI is under which ministry? Ministry of Labor and Employment. Extended sickness question will come, it is for 2 years. TB is a part of extended sickness benefit. Yes. What is enhanced sickness benefit? Enhanced sickness benefit is for sterilization, 7 days of leave for vasectomy, and 14 days of leave for tubectomies. What is maternity benefit for confinement, pregnancy under ESI scheme? 26 weeks. And what is the amount for funeral expenses? 15,000 rupees. Remember this number. INAP and I strategy. What is INAP? Every newborn action plan. It is a WHO initiative to reduce neonatal mortality rate. Just keep this in mind. It is not the Indian version. It is the WHO version to reduce neonatal mortality rate. I strategies related to yellow fever. What is the full form? Elimination of yellow fever epidemics. WHO strategy. How to eliminate yellow fever? You can eliminate yellow fever by doing precautions like vaccine. You have to take vaccination certificate from travelers. That is one thing. Main component of this is related to vector control. What is the vector for yellow fever? Aedes. So vector control methods related to Aedes, since it is a daytime biter, using insecticidal nets at daytime, larvicidal methodologies like by using abetartemifos, like those things will be asked. I strategies related to which disease? Elimination of yellow fever epidemics. Good, it is related to yellow fever, reducing the risk of yellow fever epidemics. Vector control is a part of this strategy. Answer is correct. Good. What is free days? It's sanitary pads used by rural adolescent girls Given through what scheme? Given through menstrual hygiene scheme. If they ask what is MHS menstrual hygiene scheme, ASHA worker will distribute sanitary pads for rural adolescent girls. FBNC. Facility based newborn care, hospital level. What are the facilities to be given? We have discussed this in the classes in detail, but I will tell the summary of this. Special newborn care units will be at district or sub-district hospitals. Newborn stabilization units will be at CHCs or FRU, and all the labor rooms will have newborn care corners. Repeat with me. Special or sick newborn care unit at district or sub-district hospitals. Come down, good. Newborn stabilization unit at CHC or first referral unit, and all the labor rooms will have newborn care corner. What are the facilities available in the hospitals to reduce neonatal mortality? That is facility based newborn care. So one more important thing, filariasis elimination we are targeting. Yes, we are targeting elimination in India, mainly three diseases in vector borne, that is malaria, Kala-azar and filariasis. So vector borne diseases targeted for elimination, filariasis is one, malaria and Kala-azar. So filariasis elimination strategy, we take it as MMT, make my trip in sequence. Mapping means checking the antigenicity by using immunochromatographic test and telling whether the area is endemic or not. Once you decide the area is endemic, start mass drug administration using triple drug therapy, ivermectin, DEC and albendazole together. That is three drugs in combination. When you are giving MDA annually once a year continuously for 5 years. After that, you decide whether the area is having transmission or not. That is transmission assessment survey. If the level of infection is below the threshold level, you can stop mass drug administration. So before starting, we have to do mapping. Before stopping, we have to do transmission assessment survey. What is MDA mass drug administration? Using three drugs now: ivermectin, DEC and albendazole. G. Global Action Plan for Pneumonia and Diarrhea to reduce under 5 mortality. So the targets will be asked. We have to reduce deaths from pneumonia to less than 3 per 1000 live births and deaths from diarrhea to less than 1 per 1000 live births. Remember the targets in this related to mortality from pneumonia and diarrhea. What should be the level? Global Hunger Index has 4 indicators. I am telling 3 dimensions के अंदर 4 indicators. One is percentage of undernourished population, wasting in less than 5 years, stunting in less than 5 years. So like wasting will indicate acute malnutrition and stunting will indicate chronic malnutrition, and also we count under 5 mortality. So Global Hunger Index has 4 indicators. 3 dimensions, but now I'm discussing 4 indicators for you. We have covered this in detail in the classes. When I take the global hunger index, the value of India comes under severe hunger. As of now, India is classified under severe hunger. H. Home-based newborn care, home visits by ASHA worker. We can identify the danger signal, like ASHA can go and identify the danger signals, referring the child. The number of visits under home-based newborn care, I am telling 765, remember in descending order. 7 for home delivery, 6 for hospital normal vaginal delivery, 5 for cesarean section. What is the incentive given? Tell me. We have discussed all this in the classes. I am just summarizing this. 250 rupees per child. It is not per visit, it is per child. What is home-based care of young child? That is different. Total 5 visits. Starting from 3rd month, 3, 6, 9, 12, 15th month, 3, 6, 9, 12, 15th month. This is a separate scheme. ASHA is giving home visits for young child now. How many visits? 5. Every 3 months, like 3, 6, 9, 12 and 15th. What is the incentive under this for ASHA? Same, 250 per child. So ASHA worker is giving home visits under 2 schemes. H. Home-based newborn care, home-based care of young child. in giving care of young child. When the visits she is giving, what she is counseling for? She is counseling for breastfeeding and complementary feeding, at the same time growth monitoring. Keep this in mind. The main purpose is counseling regarding feeding. H. High I Indradhanush, very important. Indradhanush, mission Indradhanush, I'm telling, related to vaccines. Initially, we used to target 7 diseases. Now it is 12 vaccine preventable diseases. Keep the number, it is 12. Childhood tuberculosis, it's not just TB, it is childhood TB, BCG vaccine, diphtheria, pertussis, tetanus, polio, measles, rubella, hepatitis B, Japanese encephalitis, rotavirus diarrhea, pneumonia and meningitis due to hip component. Hip is a part of pentavalent vaccine. I'll be discussing national vaccination schedule at last for you. One slide I will cover that will help in summarizing the same mission in the Dhanush. What are the vaccines used? So repeat with me, how many diseases are covered? 12 vaccine preventable diseases. INAP, Indian Newborn Action Plan. What is the target of INAP? To bring down neonatal mortality rate and stillbirth rate to single digit. Neonatal mortality rate and stillbirth rate to single digit by 2030. By which year? Note it down, by 2030. Some states which could not achieve this target by 2030, they will be given extra time. Individually, all the states should achieve this target by 2035. But the national level, the Indian target has to come down to single digit by 2030. Single digit of what? Repeat with me. Neonatal mortality rate and also stillbirth rate. Single digit by 2030. INAP, Intensified National Iron Plus Initiative, also known as Anemia Mukt Bharat. I'm taking the exact table from the PDF so that there is no confusion for you. Different sources, if it is a printing mistake anywhere, that will create some confusion. So directly I'm taking the table what I was using in the classes, what I am using in the classes. Yes, good. Children 6 months to 5 years, bi-weekly supplementation, 1 ml syrup is given. What is the composition of 1 ml? 20 mg elemental iron, 100 microgram folic acid. So what is the dose? Repeat with me. 20, 100. Frequency twice a week. Come to next. 5 to 9 years. Good. Weekly once. Pink color tablet. What is the dose of pink tablet? 45 mg elemental iron, 400 microgram folic acid. Adolescents, you know, within school, both boys and girls, WIFs, weekly iron folic acid supplementation. Out of school, only adolescent girls through Anganwadi center. Weekly once, blue color tablet. What is the composition? 60 mg elemental iron, 500 microgram folic acid. Pregnancy and reproductive age. First, let us discuss pregnant women. Daily one tablet, red color tablet. The dose is 60-500, starting from second trimester till delivery. 6 months हो गया. फिर उसके बाद 6 months total 180 days plus 180 days. What is the color of the tablet? Red color. Daily once. Dose 60-500. Same as adolescents, but there is color change. Red color, we want a change in the color. Red, the dose is same from second trimester. Now come to women in the reproductive age. For INAP supplementation, as you can see in the table, the age group taken is 20 to 49. Weekly once, red color tablet. 60-500 will be the dose. Along with this, reproductive women will also get periconceptional folic acid. Around conception, what is the role of folic acid? To reduce neural tube defects. Dose 400 microgram. That is totally different from IFA composition. 400 microgram only folic acid tablet during conception का मतलब 3 months before becoming pregnant, 3 months in the first trimester. That is called as periconceptional folic acid 400 microgram. What is the use to reduce neural tube defects? Abhiyan Indradhanush. I for again don't confuse between Mission Indradhanush and Abhiyan Indradhanush. Abhiyan Indradhanush is for ESI hospitals, scheme under ESI hospitals, Ministry of Labor and Employment. The main purpose is to promote sanitation. 7 days. Rainbow has 7 colors. Thank God. And what I do every day, I will change the bed sheets. In what pattern? Vibgyor pattern, violet, indigo, blue, like that. If I see today, if it is Sunday, we are using violet color bed sheet. By mistake, if you forgot the day, by seeing the color of the bed sheet, you can say, Hanji, Aaj, violet, Sunday, good. Why am I highlighting this? Because they can frame match the following question. If they frame match the following question, that will be the most difficult question. It will take memory from you. Violet, Sunday, indigo, Monday, like that. But still, they won't do that, I think so. But still, they will ask Abhiyan Indradhanush is under which ministry? ESA hospitals, labor and employment to promote sanitation. So what is Inspire initiative? It is WHO initiative. It is to eliminate child violence. It is having 7 components in this. So what is Inspire? Based on the evidence what they have generated, these things can help in reducing child violence. Proper enforcement of laws, I for implementation of laws, N for proper norms and values in the society, providing safe environment, parent support, income strengthening, response and support services, proper education and life skills. Repeat, what is Inspire implementation? Norms, safe environment, parent support, income, response and educational skills. So Inspire initiative is for what? To reduce violence against children. Janani Suraksha Yojana, hospital deliveries has to be increased by giving cash incentives for both pregnant and ASHA worker. What you should know, we have discussed in detail in the classes, but the summary I am telling. Two types of states, low performing and high performing states. Low performing state, all the pregnants are given initiatives or cash incentive for all pregnants in low performing state. High performing state, only BPL pregnants will get incentives. What is incentive for ASHA in rural area? 600 rupees. Urban area, 400 rupees. Home delivery, yes, rupees 500 for BPL pregnants. Below poverty line pregnants will get 500 rupees if it is home delivery. And in case if it is home delivery, ASHA will not be incentivized. Just the summary what I told, the main points which I put in JS5, but in detail we have discussed in the classes. Janani Shishu Suraksha Karyakram has nothing to do with cash. It is to eliminate out of pocket expenditure by giving free services to pregnant, at the same time sick infant. Shishu ka matlab it is sick infant. The pregnants are getting services in postnatal period, yes, till 6 months after delivery also they are given services. What are the services given? DTC is the mnemonic what we have discussed in the classes. DTC, diet, drugs, diagnostics. T for transport facility and C for cesarean section. C for cesarean section. Good. So what is Kilkari scheme? Kilkari was an initiative to give, it is an application which was giving vaccine reminders to come and get vaccines for children, but now it is not an update, but still if you know it is better, it is an application to give vaccine reminders. Kayakalp scheme is to promote sanitation in government hospitals, public health facilities, not in private hospitals. Around 7 parameters they consider when they come to hospital for inspection. Then they will give the points for this hospital, and based on the quality of sanitation what you have, they will be given cash awards also. Cash incentives are given for meeting quality standards. True statement. Kayakalp is to promote sanitation in Government hospitals. Kala-azar elimination, yes, important. What are the endemic states for Kala-azar in India? Bihar, West Bengal, Jharkhand, and UP, where there is a bit of rural settings. You can see the rural thatched houses where sandfly is the vector. When to say Kala-azar is eliminated when the incidence is less than one case per 10,000 population. Remember the word, it is incidence. Highlight this, please make a note of this. Less than one case per 10,000, and this target has to be achieved at block level, not at district level. This has to be achieved at block level also. The diagnostic kit, you know this, when there is Kala-azar suspect. Who is Kala-azar suspect? Fever, anemia, hepatosplenomegaly, not responding to anti-malarials, not responding to anti-malarials. Fever, anemia, hepatosplenomegaly, not responding to anti-malarials. What is the treatment you start? Start liposomal amphotericin B, single dose infusion of liposomal amphotericin B. That is a drug of choice. Active search for Kala-azar, yes, done only in endemic areas. What is Kala-azar fortnight? Search for cases, search for 15 days. That is Kala-azar fortnight, search for 15 days. And what is the insecticide of choice when I'm doing indoor residual spray for sand fly? The update is synthetic pyrethroids. It has shown some resistance to DDT, so we are using synthetic pyrethroids for indoor residual spray. Important, good. So the next L for Lakshya scheme to promote labor room quality. As you can see here, L for labor room, Q for quality. It is improving labor room quality from what level? Not in primary health center. This scheme is improving the infrastructure of labor room right from community health centers, district hospitals and medical college. Not in primary health center. Leprosy treatment part, you should know, they'll repeatedly ask this question. The duration of treatment is important because we are using the same red pack for both paucibacillary and multibacillary leprosy. The only thing which is different is duration. 6 months for paucibacillary leprosy, 12 months for multibacillary leprosy. So what is the treatment? Same red color packs. Day 1 RCD is used, rifampicin, clofazimine, dapsone. The remaining days clofazimine and dapsone. The same red color packs used for both pauci and multi. Paucibacillary 6 months treatment, 6 packs are sufficient. Multibacillary leprosy 12 months of treatment, we need 12 packs of red color to manage a case of multibacillary leprosy. Leprosy contacts, we are giving chemoprophylaxis. What is the drug used? Rifampicin single dose for chemoprophylaxis of leprosy contacts in the family. I will be discussing what is Sparsh campaign later in the alphabet S for leprosy. Again, next after L it is M, mother's absolute affection. What is the use of this scheme? To promote exclusive breastfeeding. This scheme is about breastfeeding. MCTS, mother and child tracking system. A unique identity number is given for every pregnant in India, just like Aadhaar number, UID number, what we have for an Indian citizen. We have a unique identity number for the pregnant. What is that scheme which can give UID number for the pregnant, called as mother and child tracking system, to track mother and even the child, mother for maternal antenatal care and even postnatal services, children for immunization activity. M for Mission Parivar Vikas. We don't have family planning. The word family planning program is not used. We are using this word Parivar Vikas, matlab related to development rather than just planning. The contraceptives important. Antara I have told. Injectable contraceptive. Chaya Send pill, post progesterone only pills, POPs for lactating mothers, improving the proper packaging, and also planning for holistic family planning and creating awareness in the family. Repeat: progesterone based contraceptive Antara, Chaya Send pill, POPs for lactating mothers, improving the packaging and also promoting the family planning, creating awareness for holistic family planning, and it is in a campaign mode. What is Mission Parivar Vikas? Related to family planning and their contraceptives. What is the use of this? What is the target to be achieved? Remember, some high fertility districts it is implemented. We have to achieve a target of 2.1, total fertility rate of 2.1 by 2025. What has happened? India has achieved a target of total fertility rate on an Indian national level. But some high fertility districts still are not achieving the target of 2.1. So we have to achieve the target of 2.1 by which year? By 2025. That is the role of Mission Parivar Vikas. What is Monica? Very old program. Questions are repeatedly asked because the examiner is fond of Monica. What is Monica's scheme? Monitoring the trends and determinants of cardiovascular diseases. Monitoring the trends and determinants of what? Cardiovascular diseases. WHO initiative. Going into the community, doing a survey, you are monitoring the trends and determinants of cardiovascular diseases. Monica, midday meal scheme, school children. This is the logo can be asked for you. Midday meals are given. Midday meal scheme is under which ministry? Now it is under Ministry of Education. Keep this in mind. Previously it was named as Ministry of Human Resource Development. We are not using that name now. We call it as Ministry of Education. Important. What is the composition of midday meal? One midday meal has to be planned in such a way that it will fulfill one third of calorie requirement and half of protein requirement. One third of calorie requirement, half of protein requirement. Just I am summarizing, I am giving a gist of all the updates together in alphabet mode, and I'm telling all the most important points. Obviously, we have discussed all this in detail in the classes. What is for primary children, what is for upper primary children, but the same thing I can't cover within 50 to 55 minutes in this video. This video is just a rapid revision session, bringing all the updates in alphabet mode. Keep this in mind. Good. What is MR campaign? Measles Rubella campaign. Remember, it is supplementary immunization activity. Means you go to the houses, you go to schools and vaccinate the children. One dose of MR vaccine has to be given, irrespective of previous doses. What is the age group for MR campaign? 9 months to 15 years. Means even school children are also targeted. Repeat, one dose, supplementary immunization activity, catch up activity, house to house, yes, schools, yes. The age group 9 months to 15 years, one dose irrespective of previous doses. That is MR campaign. What is Muskan initiative for children? Ensuring child friendly services in government hospitals related to children, giving proper quality care. This is mainly to improve quality related to pediatric care. National Quality Assurance Standards we have in India, NQAS, National Quality Assurance Standards. That standards, when they apply it to government hospitals, we can provide proper quality care for children starting from birth till 12 years. This initiative is for child care 0 to 12 years. What is the purpose of this? To promote quality in government hospitals related to what? Mother or child. Repeat, it is for children. What is the age group? 0 to 12 years. Muskan initiative. Good. Nischay is pregnancy testing kits. UPT, urine pregnancy testing kits, given free of cost to sub center and also Asha worker. To sub center and also to Asha worker. Don't confuse Nischay with Nikshay, tuberculosis website. TB is a notifiable disease in India, has to be notified, mandatory notification through which website? Nikshay. Whom will notify? District TB officer. You are notifying DTOs. What is the frequency of notification? Once a month. Monthly reports. Keep this in mind. Monthly once notification. Website. Tuberculosis notifiable disease in India. Who can notify? Doctor. laboratories and even chemists in India can notify tuberculosis through which website? Nikshay. What is NSSK? Navjat Shishu Suraksha Karyakram. Navjat is for newborn. This scheme is to reduce newborn neonatal mortality by training doctors and nurses. A pediatrician will be there. She will be training the doctors and nurses for what? Newborn care and resuscitation. Like if there is a case of hypothermia, infection and asphyxia. Note down hypothermia, infection and asphyxia. How we have to manage? What are the resources we have to keep? What are the skills we need to develop? That is the main initiative related to newborn mortality, that is Navjat Shishu Suraksha Karyakram. Don't confuse with Dakshata. Dakshata is to reduce maternal mortality, delivery practices. Here it is newborn care and resuscitation. Keep this in mind. NCDs related target 25 by 25 is related to mortality. 25% relative reduction in the mortality of non-communicable diseases by the year 2025. That is NCDs related 25 by 25 target. Good. What is open vial policy? Important update in vaccine. Open vial policy means if I mention date and time, I can reuse the vials in the future till 4 weeks. If I'm opening something left out, I can use the vaccines in the next session till 4 weeks. This will help in reducing vaccine wastage. That is why mention date and time important. Not applicable for BCG, measles or MR, JE, Rota and COVID related vaccines. Not applicable for, note down, BCG, measles or MR, Japanese encephalitis. You know the reason, because we dilute it, and Rotavac also. Even though it is liquid, we cannot use it after 4 hours. All these vaccine has to be used within 4 hours. Covaxin and Covishield not applicable because there is no VVM as per the recent supply. So it has to be used within 6 to 8 hours. Repeat with me: BCG, measles or MR, Japanese encephalitis, Rota, and COVID related Covaxin and Covishield. Remaining all the vials it is applicable. As you can see, it is a vial of IPV, what I am showing for you, pentavalent, DPT, hepatitis B, etc. Just keep in mind, not applicable for 5 things: BCG, JE, measles or MR, Rota and COVID, Covaxin and Covishield. Baki remaining all it is applicable. Open vial policy, if something is left out, if the date and time is mentioned, VVM is intact, then you can use it in the next session. Good. Very important alphabet P, Pradhan Mantri Surakshit Matritva Abhiyan. So what is this? PMSMA clinics, what you have on 9th of every month in hospitals, all the government hospitals and selected private hospitals. These are antenatal clinics. And the pregnant is coming from the periphery. You are doing free investigations, hemoglobin, ultrasound, even blood sugar is also included. After examination, you are giving stickers: green, normal; red, high risk pregnant; blue, pregnancy induced hypertension. Remember, blue, pregnancy induced hypertension; and yellow color for comorbid conditions like STDs, diabetes, and hypothyroidism. What are the 4 stickers used? Green, red, blue, yellow. Yellow is diabetes, STDs, and hypothyroidism. Blue is pregnancy-induced hypertension. Red is high-risk pregnant. Pradhan Mantri Surakshit Matritva Abhiyan clinics will run from primary health centers, not sub-centers, because we need a doctor at least to run the clinics. This scheme where the pregnant will get one complimentary visit either in second or third trimester. What is Pradhan Mantri Matritva Vandana Yojana? This scheme is by Ministry of Women and Child Development. Note this: Pradhan Mantri Matritva Vandana Yojana is under Ministry of Women and Child Development. Anganwadi centers related scheme. What if you are registered in Anganwadi center? Through Anganwadi centers, a cash incentive of rupees 5,000 is given for first live birth. So any pregnant, rupees 5,000 is given in three installments. So 5,000 is the total amount for first live birth. Keep this in mind. If there was stillbirth, still the pregnant is eligible for getting 5,000 rupees. It is 5,000 for first live birth. Konsa ministry? I repeat, Ministry of Women and Child Development. What is the purpose? To promote nutrition. Pradhan Mantri Jan Arogya Yojana. It's a part of Ayushman Bharat scheme. Health insurance is given. What is the amount? Up to 5 lakh per family per year. Repeat, up to 5 lakh per family per year. For what? For inpatient expenses, secondary and tertiary care. All the government hospitals, yes, it is applicable. Selected private hospitals, yes, if I go and admit, it is applicable. If I have a card like this card is portable within the country. I can go from state to state. This scheme is applicable for both rural and urban areas together. Yes, for both rural and urban areas. COVID inpatient care is a part of this. Yes, COVID inpatient care is also a part, and it is eligible for insurance under Pradhan Mantri Jan Arogya Yojana. Don't make mistake between Pradhan Mantri Jeevan Jyoti Bima Yojana, Pradhan Mantri Suraksha Bima Yojana. These are also insurance related schemes. One is life insurance, the other is accident insurance. Keep this in mind. This is giving 2 lakhs rupees. The other is also 2 lakhs. 330 per annum is the premium. 12 per annum is the premium. But I know you will not remember this. You can't remember the numbers. But at least remember Jeevan Jyoti ka matlab life insurance. Suraksha Bima ka matlab related to accidents. Okay, good. One thing important. The age group will differ. It is from 18 to 50 because it is life insurance. Keep this common sense in mind. This is 18 to 70. This insurance will also cover permanent disability due to accident, not just life. If there is permanent disability due to accident, one more trick in the scheme, and very important, one is life insurance, the other is something related to road traffic accidents. So Jeevan Jyoti Bima Yojana and Suraksha Bima Yojana, don't confuse between this. Poshan scheme, that is Prime Minister's overarching scheme for holistic nutrition. Prime Minister's overarching scheme for holistic nutrition. Related to nutrition, this was implemented in 2017, also known as National Nutrition Mission. The targets has to be achieved by 2022. Remember this, the targets has to be achieved by 2022. Good. So what are the targets related to? Related to four parameters: stunting, underweight, low birth weight, and anemia. Don't want exact value. What are the parameters included? The targets related to what? To reduce stunting, underweight, low birth weight, and anemia. Good. I usually say in the class the mnemonic like SULA: stunting, underweight, low birth weight, and pneumonia. What is that? A for anemia. SULA. SULA wine we have. It's an Indian brand. So SULA is the mnemonic. The parameters included in the Poshan Abhiyan: stunting, underweight, low birth weight, and anemia. Good. The next alphabet are revised National TB Control Program that has been updated as National TB Elimination Program. It is not just about control, it is about elimination. So there is a huge discussion on this topic, but this video will summarize the most important things, like daily regimen is used for all drugs sensitive tuberculosis, 6 months of treatment, 2 months of intensive phase, 4 months of continuation phase. It is 2 HRZE plus 4HRE, 2HRZE plus 4HRE. So total 6 months of treatment, ethambutol in continuation phase also. The number of tablets per day what you are giving for the patient is based on body weight because fixed dose combination is used. So fixed dose combination used like for what you are seeing HRZE. This is used in intensive phase. HRE is used in continuation phase. Universal DST means everyone before starting treatment has to undergo drug susceptibility testing for resistance using CVNAT or you can use TrueNAT also. All the tuberculosis patients before getting treatment has to undergo baseline drug susceptibility testing. Mandatory notification through NICSHI. If I don't notify a case of TB, IPC section 269 to 70 that is related to spread of communicable disease will be applicable. It is punishable offense. NICSHI portion Abhiyan is related to nutrition. 500 per month has to be given during treatment. 500 per month for tuberculosis patients. 99 dots is missed call initiative where the patient on opening the blister pack giving missed call to the hidden number that will help in monitoring adherence to treatment whether the patient is taking drugs or not. So this is missed call initiative free call to the hidden numbers. Rashtriya Kishore Swasthi Karyakram is for adolescents 10 to 19 years. Total 6 strategies are there. 3 things to promote like to promote adolescent reproductive and sexual health means we have to reduce sexual health issues, to promote proper nutrition, to promote proper mental health, repeat, nutrition, mental health and reproductive and sexual health. 3 things to be reduced: substance abuse, violence and injuries, and non-communicable disease. Substance abuse, violence and injuries, and non-communicable disease. Rashtriya Bal Swasthya Karyakram, as you can see here, screening and early intervention starting from 0 till 18 years, birth to 18 years. Screening for 4Ds: defects, deficiency, diseases, developmental delays, and disability. Defects, deficiency, diseases, developmental delays, and disability. What deficiencies are screened? Nutrition. Like what? Vitamin A, anemia, vitamin D, goiter, severe acute malnutrition. Repeat: vitamin A, anemia, vitamin D, goiter, severe acute malnutrition. Even doctors are also involved in screening. Mobile medical teams, mobile health units will go from place to place, house to house, even in schools. They are also involved in screening. So this is the summary of Rashtriya Bal Swasthya Karyakram. Rajiv Gandhi Shramik Kalyan Yojana is also under ESI. It is also for giving unemployment allowance. It is also under Ministry of Labor and Employment. Come to the next alphabet. Yes, first Satyas. These are trained adolescents. We train them regarding adolescent health problems. These adolescents who are trained, they will become satyas and they will go and give counseling for remaining adolescents. What is the role of satya? Counseling the remaining adolescents for adolescent issues. Satyas are peer educators. Peer means friends. We collect a group of satyas in the group. We train them. They will go and counsel. So peer educators under Rashtriya Kishore Swasthya Karyakram used for counseling purpose. Answer will be Satya. What is Suvidha? Again, Suvidha, these pads are biodegradable pads. Just like free days under menstrual hygiene scheme, even Suvidha pads are also biodegradable sanitary napkins. Sapna and Sparsh. What is Sparsh? Sparsh campaign is related to leprosy, creating awareness in the community. As you can see here, you are giving information to the community what is leprosy, how it will manifest, how to come, when to come to hospital, take treatment. Like that, you are creating awareness in the community. Sparsh Leprosy Awareness Campaign. If I want to tell in full, it is Sparsh Leprosy Awareness Campaign. Sparsh Kust Jagrukata Abhiyan means you're creating awareness in the community regarding Kust Rog. What is Kust? It is leprosy. Sparsh Kust Jagrukata Abhiyan. It is Sparsh leprosy awareness campaign. Mascot used within Sparsh campaign is Sapna. So if this is the campaign Sparsh, within Sparsh we have Sapna. She will be sending messages to the community regarding leprosy. So, what is the role of Sapna as a mascot for Sparsh Leprosy Awareness campaign? So, the next Suman scheme, that is Surakshit Matritva Ashwasan, related to maternal care. The target to be achieved is zero preventable maternal and newborn deaths. We have to make it zero. Whatever the deaths related to mother and newborn can be prevented, it has to be zero. The word Ashwasan is important in this. Even in this scheme, we are giving services free of cost, just like JSSK. In the future, Suman scheme will replace JSSK, like transport and other facilities are free of cost. But the main purpose is guarantee. Service guarantee charter has to be displayed in hospitals. Like there is an hospital in the notice board, you are displaying service guarantee charter, like these are the services to be given. After this, what you are doing, in order to make it reaching the beneficiaries, if it is not reaching, the service is not reaching the target beneficiaries, grievance redressal mechanism is also available. You can raise a complaint that I was not given this service. Repeat two things: service guarantee charter and grievance redressal mechanism. आश्वासन का मतलब guarantee, so that the services will be made sure that that will reach the target beneficiaries. Some scheme is social awareness and action to neutralize pneumonia successfully. It is to reduce pneumonia related deaths. One is creating awareness, how it will manifest, and what are the actions to be taken at grassroots level. Like if there is health and wellness center, we have to keep pulse oximeters to monitor the saturation. At the same time, if I want to refer a child, I will permit ANMs for using pre-referral dose of antibiotics. So repeat: pulse oximeters at health and wellness centers, pre-referral dose of antibiotics by grassroots workers. Sabla scheme, one more is related to empowerment of adolescent girls under Ministry of Women and Child Development, implemented through Anganwadi centers. One is promoting nutrition, at the same time vocational skill education. We are training them for employment opportunities, such skills where you train the adolescent girls for employment related, like you're teaching them something so that they can earn their livelihood. That is called as vocational skill. Don't take it as vacation. No, it is vocational skill education is a part of Sabla scheme, correct? Ujala, Ujwala Yojana and Ujwala scheme. Most of the time student ask me, sir, what is the difference? Ujala, these are bulbs, energy efficient LEDs. Unnat Jyoti means energy efficient bulbs to be given for everyone, not just below poverty line. It is not free of cost, it is affordable bulbs. That is why it is a part of domestic efficient lighting program under Ministry of Power and Electricity in the center. Pradhan Mantri Ujjwala Yojana, giving LPG connection, free LPG for BPL families, will help in reducing indoor air pollution, correct? Will promote health of the people. At the same time, if I am giving LPG connection, what they say, they can cook the food very fast, the mother will take care of the children, the girl child who was in charge of those small children before will go to school. That is one more indirect benefit given by Pradhan Mantri Ujjwala Yojana under Ministry of Petroleum and Natural Gas. What is Ujjwala scheme under Ministry of Women and Child Development? This is related to trafficking, to prevent women and child trafficking. That is Ujjwala scheme under Ministry of Women and Child Development. Umeed scheme, one more new scheme: unique methods for management and treatment of inherited disorders. What is happening in our system now? We are targeting the next level. congenital and inherited disorders related to that. Usually, we are using the word management and treatment rather than saying prevention because it is very difficult to prevent them. They will happen, but you have to diagnose it and you have to treat it so that you can reduce mortalities. Training the doctors in genetics and also creating awareness on genetic disorders. And for diagnostic purpose, we have Nidan Kendras, National Inherited Diseases Administration, National Inherited Disorders Administration Kendras, matlab multi-speciality hospitals like AIMS, etc., where you get diagnostic facilities related to genetic disorders. What is the role of Nidhan Kendras in Umeed scheme for diagnostic purpose? Keep this in mind. It is mainly for diagnostic purpose. What is WIPS? Weekly iron folic acid supplementation for adolescents is a part of Anemia Mukt Bharat. You can see this blue color tablet. I have discussed this already for adolescent. WIPS is only for school children, both boys and girls. The dose weekly once iron folic acid, 60 mg elemental iron and 500 microgram folic acid along with IFA supplementation. Within WEFs, we do screening by taking conjunctival pallor, not hemoglobin. So it is screening for moderate and severe anemia, dietary counseling at the same time biannual deworming. Tell me four strategies of WIPS. Repeat with me. Good. Weekly iron folic acid, screening for moderate and severe anemia. One more important, biannual deworming using albendazole and dietary counseling. Good. So overall, we have finished all the updates in A to Z mode. The last letter is the WWIFS, weekly iron folic acid supplementation for adolescent school children as a part of Anemia Mukt Bharat. Good. So again, finally, students, they'll be asking me, sir, along with your updates, please make me revise national immunization schedule and give me the recent data on recent indicators which are important. So usually I do this after summarizing all the updates in A to Z mode. I always keep my last two slides for one is national vaccination schedule. So at birth, we are giving BCG, OPV 0 dose and hepatitis B birth dose. Hepatitis B birth dose, yes, for all the newborns, it is compulsory in our country. It has to be given within 24 hours. 6 weeks, we are giving OPV 1, OPV 2 at 10th week and 14th week. Means 6th and 14, you should remember OPV first dose, second dose, third dose. What OPV we are using? We are using bivalent OPVs, not trivalent. Pentavalent, first dose, second dose, third dose. OPV and pentavalent, these two vaccines are used in all the states. Pentavalent, not in selected states. Pentavalent is throughout the country now, remember that. Along with this, in selected states, we are using Rota, IPV, and PCVs. Like Rota first dose, second dose, and third dose at 6, 10, 14. Fractional IPV intradermal, first dose and second dose, 6 and 14. And pneumococcal conjugate vaccine, first dose and second dose. These three vaccines, rest in peace. Rota, IPV, PCV, only in selected states, around 6, 10, 14 weeks. Come to 9th month, some states they use measles. Most of the states they are using MR, measles, rubella. First dose, vitamin A is given. Japanese encephalitis, first dose only in endemic states and PCV booster. Underline this PCV booster at 9th month. Only in selected states. 16 to 24, the child has crossed 1 year. So measles second dose or MR second dose. JE second dose or we call it as booster. DPT booster and OPV booster. 5 to 6, it is DPT second booster. Important 10 and 16 years. TD first dose, TD second dose. Adolescents, we are using TD now. T for tetanus toxoid, D for adult dose of diphtheria toxoid. Pregnants, yes, TD1 as early as possible. TD2 4 weeks after the first dose. What is the role of TD booster in pregnancy? If the pregnancy occur within 3 years of the last pregnancy and she has taken 2 doses before, immunized completely, If there is pregnancy within 3 years, take one dose of TD booster. So even in pregnancy it is TD vaccine. Before it was TT, just tetanus toxoid. Now it is TD, small letter, adult dose of diphtheria toxoid. The dose, the Loeffler units what we have in DPT capital D, that is totally different from this small letter TD vaccine. Come to the last slide. Sir, show me the important values as of now. What is the recent indicator used and what are important for me to remember? You can't remember everything. Just try to remember if possible, I'm telling. They might ask the question or they may not ask the question. Fine, but still, I'm telling, if possible, remember crude birth rate 19.7, death rate 6, growth rate 1.3%. The unit of birth rate and death rate is per thousand mid-year population, growth rate in percentage. Total fertility rate 2, we have achieved the level 2.1 target has been achieved at national level. The recent value is 2. Come to these three indicators. If possible, remember these three properly. Neonatal mortality rate 24.9, infant mortality rate is 30 per thousand live births. What is the recent infant mortality rate? That can be the question if they ask recent value. What is the recent value for maternal mortality ratio? It is 103 per 1 lakh live births. According to Sustainable Development Goal, what should be the target? Tell me good. It has to be less than 70. What is the recent maternal mortality ratio of our country? 103 per 1 lakh live births. Good. So again on a finishing note, I'm telling this. So if there is any competition, it's always competing within you, getting the best out of you, mutating in a positive way, learning day by day, getting the better version of you day by day, so that comparatively I am better today. That feeling of satisfaction has to come. So, hope this video has been helpful for you in revising all the updates in A to Z format and summarizing with national vaccination schedule and also recent indicators. So again, I always say this, making one justice to this subject, giving importance to this trump card where most of the questions can come. So again, keep a note when you listen to my video again. Try to note down the keywords. Try to note down the keywords. That will be very, very helpful for you to recall all the points, if possible, in a better way. So we have done our level best in this session to summarize it in a sequential alphabet mode. So fine, feel free to express yourself. Thanks for being a part of our journey. Good. Thank you so much. So, in case if you want to follow my updates, I have my Facebook group, ShettysPSM. You can join the group. Follow me on Instagram, the recent trend, what is going on Insta, Shetty54. You can use this ID. Or if I say, like, sir, I want to ask something to you, WhatsApp me in this number. So I've given all the sources for you to reach me if possible: Facebook, Instagram, and WhatsApp. So again, I say this, thanks for being a part of my journey. It's always mutual. We learn from you, and you guys learn from us. So it's always mutual learning, getting the best and becoming the better version of ours day by day. So finally, I'm signing off. Thank you so much. Thank you so much.